Very good morning, good afternoon, and good evening to all of you who have joined from different parts of the world. Welcome to this third session of Sexual Health with Equity, what we call SHE and Rights Initiative, that is co-hosted by Asia Pacific Media Alliance for Health and Development, or APCAT Media, International Planned Parenthood Federation, or IPPF, Women's Global Network for Reproductive Rights, or WGNRR, Asian Pacific Resource and Research Center for Women, ARROW, and CNS. The theme of today's session is Gender Equality, Disability Rights, and Ending Gender-Based Violence. To mark the 16 days of activism against gender-based violence, which has already begun, and the International Day of Persons with Disabilities that will be observed as usual, as is done every year, on 3rd of December, next week. As we all know, our governments have promised sustainable development for everyone by 2030, where no one is left behind. Gender equality for all is enshrined in the Sustainable Development Goals. But progress, as we know, at best is sketchy and in so many aspects regressive. Unless we dismantle patriarchy, ensure racial equity, ensure justice for all gender diverse people, ensure disability inclusion and justice, end ageism and ableism, we will not be able to end all forms of gender-based violence. Economic justice, redistributive justice, social and cultural rights justice, climate justice, health justice, accountability to people are critical if we are to deliver on gender justice. And the only pathway to a socially just and ecologically sustainable world for all of us and for our planet is if we walk the talk on a feminist, fossil fuel-free future. 16 days of activism against all forms of gender-based violence and the upcoming International Day of Persons with Disabilities gives us an opportunity to better our own understanding of how anti-rights movements are impacting disability rights, sexual and reproductive health rights, ending ableism. They are actually impacting ending ableism and broader gender justice, all of which are so much connected to each other. A few quick housekeeping announcements before we begin. Participants, please type in your questions, comments, and reflections in the chat box, even as the speakers present. Also, please mention the name of your media outlet or organization. We will take up all relevant questions and comments in the question and answer session after all speakers have presented. Without any further ado, I would like to begin the session with a video recording of BENEDICTA OYEDAYO from Nigeria, who works as a community engagement and partnership lead, International Planned Parenthood Federation for the Africa region. She is an intersectional feminist and passionate about disability and women's rights. Working and living at the nexus of multiple identities, she is interested in the interconnectedness of sexuality, disability, climate, and gender justice. She was to be present online in our program today, but due to some last-minute travel assignment, she would be on a plane right now. Yet, she took the trouble of sending her recorded presentation, and here it is. We cannot hear her.
Five-hearted loss I'm wearing a black. Hi, good day, everyone. My name is BENEDICTA OYEDAYO. My pronouns are she, her, and I'm a Black African woman with 5-parted locks. I'm wearing a black t-shirt that says feminist in white. I have a blue and cream pair of glasses on. And it is a great honor to speak to you today during the significant period of the 16 Days of Activism against gender-based violence. This annual campaign is a global call to action. And for me, it is deeply personal. It is a moment for reflection and recommitment to ensuring that no one is left behind in our fight for justice as well as equality. As we focus on ending gender-based violence, it is crucial for us to recognize that violence faced by women and girls does not affect all of us equally. For women and girls with disabilities, the intersection of ableism, sexism, and systemic exclusion creates additional layer of vulnerability and marginalization. It means greater exposure to violence, often in the hands of caregiver partners or institutions, systems, and a fewer opportunities to escape, report, or heal from these abuses. I speak on intersectionality a lot, and I'm popularly referred to as the intersectional evangelist, because intersectionality provides us with a powerful lens to understand and address these realities. Intersectionality reminds us that gender-based violence cannot be disentangled from other forms of oppression, whether rooted in disability, socioeconomic status, sexual orientation, and gender identity as sex characteristics. In Africa today, we face an alarming rise and increase of anti-rights movements, opposition across the continent. Patriarchal politics and cultural forces are pushing back against the hard gains of feminist, LGBTQI+, and disability justice movements. And this backlash is not abstract. It has real consequences. It has manifested in legislation that criminalizes, underfunds gender equality program and excludes marginalized communities. For persons with disabilities, this means continued invisibility and heightened vulnerability. Survivors of gender-based violence with disabilities are faced greater with inaccessible shelter, unsupportive justice systems, and a culture of silence that prioritizes shame over accountability. The anti-rights movement strives on division, and it has used divide and conquer method to sustain oppression. It seeks to pit communities against one another and to erode the collective power of our struggle. And this is why cross-movement solidarity is just an ideal. It is not just an idea, it is necessity. It is not just ideal, it is a necessity. Now more than ever, there is a need for us to come together. The disability justice movement, feminist, LGBTQI+, women's rights movement, and all movements fighting against oppression and also anti-gender-based violence movements must come together now despite our differences in programming, but because of our champion against oppression. Our struggles are interconnected, and our victories will only be sustained if they are built on the foundation of mutual respect and collaboration. And what does cross-movement solidarity means in this? We must amplify the lived experiences of those at the intersection of multiple oppression. People, as a renowned feminist, disabled feminist, lesbian writer, Audre Lorde says, there is no such thing as a single-issued life because we do not live a single-issued story. We must amplify the voices of people who live and exist at the intersection of multiple marginalized identities, such as women and girls with disabilities, ensuring that our voices shape policies, program, as well as our advocacy efforts. By uniting our movements, we can push back against the rhetoric that seems to undermine equality and justice. Together, we can frame gender-based violence, disability rights, and gender equality as a non-negotiable human rights. From ensuring that crisis centers are accessible to addressing the unique economic vulnerabilities of persons with disabilities, specifically women and girls with disabilities. Solidarity means creating programs that respond to everyone. These 16 days of activism against gender-based violence offers us a critical platform to build this solidarity. This year, as we mark the 16 days of activism alongside the International Day of Persons with Disabilities on the 3rd of December, a reminder that disability inclusion must be centered in our efforts to end gender-based violence. We must also confront the reality of GBV is a symptom of broader system of oppression, patriarchy, ableism, racism, and economic inequality, reinforcing one another, creating environments that violence thrives. The road ahead is not easy. The forces of oppression are well organized, especially within the African context. As we can see, the Anti-Homosexuality Bill, Anti-Homosexuality Act of Uganda that criminalizes LGBTQI+ identities, the rising bills in Burkina Faso, the rising bills in Ghana, and across the African continent. And these are the systems we seek to dismantle because this affects you. Quoting Audre Lorde again, she says, without community, there is no liberation. Community must be built on recognizing and valuing our differences, not erasing them. It must be rooted in accountability, solidarity, and shared vision for a world free of violence and oppression. Let us use these 16 days to affirm our commitment to intersectionality and cross-movement solidarity. Let us remind the world and one another that justice is not a privilege, but justice is a right. And in order for justice to be attained, every voice must be at the table. Everybody must be recognized. LGBTQI+ persons, persons with disabilities, women and girls, young people, gender non-conforming folks, non-binaries. Everyone must be at the table in order for freedom as well as liberation together, because none of us are free until all of us are free. Thank you very much. My name is BENEDICTA OYEWOLE, and I work with the International Planned Parenthood Federation African region as the Community Engagement and Partnerships Lead. Thank you.
Thank you very much, BENEDICTA. And we are really grateful to you for taking the trouble of, I think she was in the middle of some 2 flights and she recorded this at the airport and she sent it to us. And justice indeed is our right. And as you said, none of us are free till all of us are free. Any questions and comments for BENEDICTA from the participants, please put them in the chat box and we will forward them to her and then get back to you with the answers. I now invite Stephanie MUSHO, lawyer and regional coordinator, Catalyst Africa. Steph, as we call her, is a human rights lawyer in Kenya who has worked in gender and reproductive justice. She is the founder host of the Steph MUSHO Show, an audiovisual podcast on leadership in Africa. She is also a senior New Voices fellow at the Aspen Institute. Welcome, Steph, and thanks for being with us at this unearthly morning hour in your part of the globe.
Thank you so much. It's great to be here. I don't know if you can hear me.
Yes, we can hear you very clearly.
Oh, perfect. Yeah, it's great to be here. And as I thought about, what I was going to speak on today when we talk about gender equality and disability, I'm reminded of the anti-rights, anti-gender movement, which the previous speaker spoke about. And, looking at the footprint of this global movement across Africa. And I'm from Kenya, so I'll be drawing some examples from Kenya. I don't know if you've been following or you've been seeing the attacks on women, attacks on sexual minorities. In Kenya, we have a femicide systemic issue. Just a month ago, a female cyclist had been stabbed and left for dead on a major highway in Nairobi. In a different situation. I think 2 days later, we found female body parts, and it was reported that human flesh were removed from these bones and had been boiled, and these were dumped near the main cemetery in the capital, Nairobi. And despite all these stories, and there's so many that go unreported, the National Police Service has reported that at least 97 women are being killed in Kenya, yet the Director of Criminal Investigations refuses to recognize these deaths as femicide. So we see an issue, right, from a femicide perspective, yet the people supposed to be protecting us are denying this. And what's making this even worse is that in Kenya, we have this national policy on family promotion and protection, which restricts the options that are available to women in abusive marriages because it stigmatizes divorce. I know we've all heard about this very tired narrative that needs to be retired, that God hates divorce and divorce is sinful, right? It's shrouded in a lot of stigma. But because of this family promotion and protection policy, they're advancing alternative dispute resolutions and encouraging women to stay in marriage and despite any sort of abuse. But what's interesting is that the family policy is deeply rooted in the global anti-rights, anti-gender movement, because like the previous speaker said, this global opposition movement is spreading its tentacles across the African continent. They started with the anti-homophobic bills and laws that have been, sweeping Africa, in Ghana, in Uganda, in Kenya, and in Congo. But similarly, they're introducing policy such as this, like we're seeing in Kenya, and the president enacted this earlier in 2023.
Steph, can I interrupt, please? Can
yes.
we see your video if it is okay with you?
Oh, sure. Oh, no, I thought my video was on. I'm so sorry.
No, sorry.
Okay,
Yeah.
Can you see me now?
Yes.
Okay, great. So, I was bringing in the nexus between what we're seeing in Kenya, and linking it to the global anti-rights, anti-movement. So we're seeing them really advancing their own agenda and mainstreaming that in legal and policy frameworks across the African continent. This is one case we're seeing this through. 2 years ago, Mozilla Foundation found that one of these main opposition groups that are operating in East Africa, called Citizen Go, are paying unsuspecting and unemployed Kenyan youth to advance misinformation and disinformation on Twitter, right? And Citizen Go has also been part of the movement that has completely ruptured around our sexual and reproductive health and rights and protection of women and girls and sexual minorities. So I have this podcast, The New Cold War. And, if you think about the New Cold War, this goes back to when we had the ideological war between communism and capitalism. But we're seeing the same thing happening right now, where we have the anti-rights movement, really coordinated, well-financed, well-resourced, and they're advancing their detrimental positions against we feminists and the rights movement, But one thing that I'd also like to say is that within or amongst ourselves, we also have opposition. In as much as we recognize that there's the anti-rights movement, amongst us, we do have opposition because we're so fragmented and we work in silos. And there's no way you can advance human rights and say that you work on disability rights, but you're not going to touch on LGBTQ rights, or you're not going to touch on abortion rights. You draw the line where comprehensive sexuality education starts, for example. Human rights are indivisible and they're inalienable. We can't cherry pick them. It's not a buffet where we can pick what we like and what we don't like. For us to advance human rights, including the protection of, disability rights, and to advance gender equality, we must move collaboratively. And so I just wanted to call out the fragmentation within the space. Now, we've seen the rise of fascism, right? Fascism is spreading across of Europe, and we're seeing budget cuts going, that are hitting gender equality programs. In the United States, here where I'm at, Donald Trump has just won an election, and it's mind-blowing. But what are we going to see? This Project 2025, we're going to see the expansion of the global gag rule. But also there's a lady called Valerie Huber, who I think everybody working on rights needs to know about, and her mechanism called Protego. Now, Valerie Huber is a former advisor of President Trump, and she has an organization called the Institute of Women's Health. And they are the drivers of the policy that I spoke about and the laws that I'm speaking about, right? It's crazy that they say that these rights are a foreign export, but Valerie Huber is a white American woman. Citizen Go is a white organization that is headquartered in Madrid with it's just white European people on their leadership. If you think about Family Watch International, this is US based organization by Sharon and Greg Slater. So it's ironic that they say then that our rights, our sexual and reproductive health and rights are foreign, yet these are foreign organizations that are using local organizations, just like the Cold War, having these proxy wars to advance their deleterious footprint. But back to Valerie Huber. Now, there's a Geneva Consensus Declaration. And someone said it so perfectly to me that not everything that is termed Geneva is advancing human rights. And this is one example. When we say Geneva Consensus Declaration, and the anti-rights movement is perfect because they do this so perfectly. Geneva Consensus Declaration, which is tied to human rights, Geneva. Family protection and family values, which a lot of us in Africa value so much, right? And so they found perfect ways to advance their rhetoric. But the Geneva Consensus Declaration is a non-binding agreement that, Valerie Huber has managed to convince over 30 UN member states to sign on to. And one, it does not recognize the international human right to safe abortion, which is completely it's out of this world, because we have the Maputo Protocol, we have the UN CEDAW, we have decisions coming out of human rights mechanisms. But this is one thing that, that they've agreed as countries. The second thing is that they're only going to be driven or promoting their national positions while engaging in international mechanisms. And as a Pan-African feminist, I'm extremely I love the idea of sovereignty, right? It's extremely important, especially in quashing colonialism. But if you think about where we're at now and the raging wars that are sweeping not just the world, but even the African continent, that a lot of times never even make it to the media. This is because of advancing your national positions. Nationalism is dangerous for international cooperation. And so it's important that we know that this is happening, so that we're able to have very strong interventions as we advance gender equality and as we advance the rights, disability rights, So, in a nutshell, this is just things that I wanted to spotlight, and I'm happy to take any questions.
Thank you very much, Steph. Thank you. And thank you for your energizing and inspirational talk. And definitely we would keep in touch, and what you have said is right, that we cannot cherry pick human rights. Same way as we cannot cherry pick the sustainable development goals, because one is interlinked to the other. And therefore, working in silos is not going to achieve anything. Thanks for being there. I hope you're having your cup of coffee now. And I now welcome my dear friend ABIA AKRAM, founder leader of National Forum of Women with Disabilities, and she leads the Disability Rights Group at Asia Pacific Regional Civil Society Engagement Mechanism, or what we call AP-RCEM. Welcome, ABIA, and we would love to hear from you your insights on sexual and gender-based violence and disability rights, especially in the context of the rising anti-rights movements in our countries that are posing a threat to gender justice.
Thank you. Thank you so much, Yuva, for having me in this very important discussion while we are celebrating the International Disability Day. We are commemorating the 16 days of activism, and we're talking about a very huge agenda. It's quite challenging. We all know that sustainable development goals are still not on the track. Still, a lot of challenges faced by diversified groups at the grassroots level, at the regional level, and even on the global level. And when we talk more about the girls or boys and all the transgender with disabilities, LGBTIQ, all those diversified groups, the challenges they are facing, it increase a lot, and especially for the gender-based violence and sexual harassment of women and girls with disability. When we started the conversation, it took us 2 decades to talk and reach on this point where we are talking about the human rights perspective. We are talking about the implementation of the Sustainable Development Goals. We are talking about the implementation of the UN Convention on the Rights of Persons with Disability, and interlinking it with all the conventions, constitutions, and all. But again, what we have been witnessing, that women and girls with disability, they face 4 times greater the gender-based violence and the sexual harassment than the non-disabled woman. And it's we have done recently a research, and that indicated like all the family members, care support workers, or within their own sectors, they are the preparators are there and facing all those challenges. Another challenge that women and girls with disabilities, with all their diversities, they are facing in the flood affected areas, in all the humanitarian response, climate change, because that creating lot of challenges. So I'm talking about 10 to 15% of the total population. That's a huge number of persons with disability. And then 50% of them are women and girls with disability, and more than 80% are from the global south. Despite all those challenges, we really need to remove that, as my fellow speakers have already talked about it. Like, it's very important how systematically we can reduce these policies and the legislations that are existing, what systematic changes we are creating in the whole environment, because it's all about the communication barriers, it's a policy, legislative barriers. We are talking about the diversity and the social constraint as well. I'm just sharing few examples, like in the South Asia countries, when we were doing and working with the women and girls with disability, the support systems and the referral pathways are not accessible. So if we're talking about the gender-based violence and the sexual harassment, it's really complicated for, on the one hand, to understand that it's our right as a person with disability to talk about it, because we need to be treated as an equal citizen. And again, on the same time, if we go to the support systems, the protection policies, the protection system, that is not accessible for them. For a wheelchair user, just going to the police station, making a report, it's so complicated because the police departments are not accessible for them. Again, talking to the crisis center, going to all those diversified areas where we can get the protection, it's really hard to communicate for a deaf woman. for the intellectual disabilities, it's also again very complicated for them to go and talk about their rights. So how we create this referral systems more inclusive and responsive to the needs of women and girls with disability. For this purpose, we have started a project in which we were just doing the awareness on the journal perspective of the understanding of gender-based violence and how important it is to talk about it. And then the second stage, we went for the assessments of the GBV service providers to check what kind of services they are providing and how we can negotiate with them to make it more responsive. And thirdly, we work closely with the government, with the stakeholders to review their policies, how they are incorporating that challenges. And I think advocacy and the campaigns, and it's really important part of the addressing gender-based violence against persons with disability, diversified groups at the community, at the regional and the global level. We talked about the more engagements in the data, in the protections of that, but again, the services we are using, like technology facilitated gender-based violence, it's so huge that it's really difficult to control that because we are in the technology phase and where everyone is using the mobile phones and accessing those services. But how we create that safe space for the persons with diverse disabilities is really important. And we're working on that, like how we could take that platform to achieve. We need those systematic barriers to remove for the inclusion of persons with diverse disabilities, but at the same time, women-led organization, we are talking about the both movement, the disability movement and the gender movement. So I'm very thankful for the opportunity to talk about the women and girls with disability rights today, so we can see what are the possibilities, how the experts with the disabilities can talk about their inclusion, and in the programs they can talk more on the training part, capacity building, policies, legislation, and also engaging the grassroots level organizations of persons with disability is very important, because once we have the voices on the table, they will be able to take more systematic decisions, engage the local communities where they are existing, and how to reach out to them. And also on the global agenda, when we're doing the advocacy, we need to make sure all the advocacy systems are more accessible. Like if we are running the campaigns on the 16 days of activism, are we talking about the visual impaired, hearing impaired, and all those diversified disabilities to be incorporated? So at least they have the understanding what we are talking about and how they can be part of our movement building. They can be part of our advisory role. So it's more solidarity and access to development, justice, and how they have that equal opportunities. So thank you so much. If you have any questions, we can further discuss, because it's a long way to go. We are talking about the 2 decades almost, but still we need to take the action now, because this is the time. If we exclude that group again, we have been seeing like parents pray that our daughters die before we die. So where we are reaching, how we are systematically engaging them and taking that work together. Thank you.
Thank you, ABIA. Of course, there will be questions at the end of when we all have presented. And thank you for talking of creating a friendly referral system. And also to me, person with disability, all of us have some disability or the other. When we are talking of what is not a disability, I think that for me, it's a complex issue, because then we are trying to compare with something which somebody has created to be very perfect. And all of us are a person first, and disability is secondary. So we have to keep the person in mind, and then create a suitable atmosphere and situation where all of us with our disabilities can be equal. And this is what I'm reminded of, the International Convention on the Rights of Persons with Disability, which declares that all these persons should have the same range, quality, and standard of free or affordable healthcare and programs as provided to other persons. But as you said, the road ahead is not easy and we are still far behind what we want to achieve. Thank you. Our next speaker is DEBANJANA Choudhury, Executive Director at Women's Global Network for Reproductive Rights, a global network that connects and strengthens movements for sexual and reproductive health, rights, and justice. Welcome, DEBANJANA. We are so happy to have you with us again. And could you please tell us how the rising anti-rights push is impacting sexual and reproductive health and gender equality overall? What are the challenges and how to overcome them to ensure that gender equality and rights do not slide back? Over to you.
Thank you so much, Shobha. Thank you for having me again. And it is such a pleasure to be here with all of you and share my perspective. I'm DEBANJANA Choudhury. My pronouns are she and her. I'm a brown person. I'm from India. I have parted hair right now, side partition, and I'm wearing earrings and a gray t-shirt. Thank you so much. So it's hard to follow what our previous speakers have already shared, and ABIA has raised a very potent point about access. And I'm going to talk a little more on that. So we recently concluded the Beijing 30 recommendations. A lot of us were there, and like a lot of conventions, we saw that a lot of state actors and governments are also there. But what is alarming is that all these state actors and governments currently are trying to underplay rights, particularly sexual and reproductive health rights and justice. We are seeing that there is a huge pressure to dial down the language around rights, around equality and equity. And this is extremely alarming. And of course, with the recent changes in US politics, administration, we are anticipating backlashes. Like my colleagues previously shared that, whatever happens in US, it does have an impact on all of us, and Asia is no different. I'm so sorry if you're hearing a background noise. It's a little beyond my control. It's happening in the neighborhood, so I apologize for that. So coming back to how anti-rights movements are raising their heads, and we find them around everywhere. So anti-rights movements, of course, they are highly organized. They're extremely well resourced in terms of human resources as well as funding. And we know that there is a huge momentum and push within these anti-rights groups to create narratives in each of the countries, in each of the contexts, to further, create the gap of access on SRHR. We anticipate that in the coming few months, we'll see that, there'll be heavy further cut downs on SRHR advocacy programs, on safe abortion services, comprehensive abortion care. And this will impact girls, adolescents, women, and all pregnant persons. It'll rob them of their bodily autonomy and choice. So in the spirit of solidarity, of course, it is now very crucial that we all join hands, we collaborate, because collaboration is going to lead to stronger voices and unified action to protect SRHR rights. When we of course need to think about how diverse we are, because we have to acknowledge that we are equally fragmented in this space. We need to unify now, and if we don't do that, then the opposition will take the space. They are going to create narratives around families, narratives around family systems, traditional values, which are going to hurt us even more in the future years. Talking about marginalized, excluded communities, they are definitely further alienated. It's an added layer of challenge. And there is an emerging worrying trend both in India and Philippines. I'm going to talk a little bit about both India and Philippines and the context we are in. And we saw that this year has been the year for elections. Even India voted. But how many times did SRHR, women's rights, or reproductive health rights came as a mandate? No, it didn't. And next year, Philippines is going to vote. It's gearing up for elections, and we are working very closely with lawmakers, pro-choice legislators, and we are driving the conversation. We as WGNRR, we would also publicly make information available to voters, to the entire demography, to understand where their legislators are coming from. What is their opinion on SRHR? How inclusive are they? What is their opinion on SOGI, on LGBTQI rights? What is their opinion on making access accessible? So we are going to do all of those steps. Yes, advocacy campaign very much needs to be focused, and it needs to be better. It needs to be stronger. And to share a bit about, how we are tackling this challenge is that we will engage with stakeholders, candidates, share candidates' stance with public to raise awareness. And in India, where we have worked in the past, and in the couple of years, we saw changes in the safe abortion law in India, which is yet to be translated on ground as action. We still see a lot of stigma and taboo. We have worked with lawmakers, legal expert providers to understand their perceptions on SRHR and find entry points to carry discussions on SRHR, particularly safe abortion rights. And I think as defenders and activists, it's important that we engage with wide range of stakeholders. We need to reach out to providers as well, to advocates, to policymakers. We need to make space for young voices, young people, persons with disability, pregnant persons. We need to make the language more inclusive. We need to be more inclusive in the entire way we work. From a programmatic aspect, we need to we have to go back to a blank slate and start understanding what do each of these groups need. How do we unify them? How do we represent everyone collectively? How do we ensure that justice is same for all? Equity truly means equity, and equality truly means equality. So the civil society space too needs collaborative approach. It needs to have room for discussion. There should be efforts made to ensure that voices of the most vulnerable and marginalized sections and geographies are adequately represented. Yes, anti-rights rhetoric is increasing. It's coming from various angles. We are hearing, again, traditional values. Where do women lie? Where they are, send them back to kitchen. Then there are very pronatal narratives, which are extremely dangerous, which is emerging. We are hearing a lot of countries in Asia talking about, okay, our replacement rate has gone down. Our fertility rate has gone down. So what do? We ask the women to bear more children. So all these narratives, if you are hearing it now, it's going to just grow louder. And if we don't take actions, we are going to be in a situation where the damage is already done. It's taken us a lot, many years. Like ABIA said, it's taken 2 decades to talk about disability rights. It's taken more than that to talk about women's rights in the same parlance as human rights. We cannot step back. We need to work together. We need to make sure that whom we are engaging with. And as an advocate, I've always felt that we in the sector, in the civil society space, we tend to spread the word in an echo chamber. We need to break that echo chamber. We need to come out and understand other perspectives so that we are better prepared. So a little anecdote I've heard from a lot of colleagues previously is that the anti-choice people, the anti-rights movement, they often come and occupy spaces which are meant for pro-choice discussions. They come as observers, they come as silent listeners, and they take the material and use the material against us. They use our language, so they are co-opting language. So now that's again an area which is extremely harmful. They are co-opting the human rights language. They are co-opting the language of equity to for their purposes, for their means. So yes, Shobha, to your point, anti-rights movements are increasing. What we need to do is come together, collaborate, have unified voices. And as civil society organizations, we need to make sure that we are intersectional, we are inclusive in the true spirit and not just on paper. I'll stop at that, and I'm here for any questions. Thank you.
Thank you very much, Debanjana. And thank you for pointing out that the anti-writers writers, rather, we can say, they are changing the narrative. It is in the name of family. The onus and all the restrictions are now again going on to women, that they want to save the family. Even the Geneva Consensus talks of maintaining family integrity. And in the name of that, the harm which they are perpetrating, which has begun and which is supposed to continue, is unimaginable. So we are in very deep waters, but I'm sure we'll be able to swim out of it as we try hard and with people like you on board. We had another speaker for us today, Stephanie from Africa, but perhaps she is late, so we will go on to the question and answer and comments session. And if Stephanie comes, then we will invite her to speak. So there are some questions already there, and I request the participants to please type in your questions or comments in the chat box. We have a question for ABIA from, just a moment. Yes. What more needs to be done to promote sexual reproductive health and rights of people with disabilities and vulnerable populations, and provide them with affordable, accessible, community-based SRH services, and transform existing health systems into more disability inclusive and barriers-free?
Yeah, thank you so much for the question. I think this is very important when we talk about the community-based inclusive development. And from this perspective of the sexual health and reproductive rights and the health systems to be inclusive, we need to again engage the local organizations or person with disability. That's the key, because they are going to talk about their own perspective, their own needs. Secondly, we have conducted few trainings for the doctors, for the whole staff of the health system, the practitioners from the top management, like Ministry of Human Rights, from the Ministry of Health to the bottom, and just engage them in the conversation. Because we have seen most of the time when we have the intellectually disabled woman who got pregnant during the one of the flood response area, and nobody was there to assist her. But when her mother took her to the hospital, the only thing they proposed is the forced sterilization. And I think this is not the choice of that girl. And this is mostly happening with all the women and girls with disability, that forced sterilization, they think, is the only solution. So we need to create that awareness among the health systems, how important it is to get the choices and the rights of those women and girls with disability. And secondly, making your environment more conducive and accessible for them. If we talk about the context of the strategies like community-based or community health workers, how we engage them, conducting the trainings for them, giving them awareness by women and girls with disability, providing them the psychosocial support to women and girls with disability by women with disability. So these are just small initiatives, but it create a huge impact on the whole system. We just like asked a simple question. I think I asked all the sessions like, how many of you use the wheelchair? And mostly people respond like, we don't use the wheelchair. But I just said like, you came on a car that has the wheels and the chair. So everyone used the wheelchair, but your
Yes.
needs are different. So if we see on that perspective that everyone have a different needs, we don't need to fix that. Disability is not curable. Disability needs just that environment that is enabling and inclusive, so everyone can get access to that, to the health, to the education, employment, all those systems. Yeah.
Yeah, thank you. There is a question. It is in the chat box, and I think Steph has answered it, but I would like everyone to hear. Mona Yadav is curious to know the context of persons with disabilities facing gender-based violence in different parts of Africa, and also in the context of anti-racist movement and Western politics. Steph.
Sorry, is that the question on?
Yes, that's the question on the context of persons with disabilities facing gender-based violence in different parts of Africa, and also in the context of the anti-racist movement and Western politics.
Okay. Yeah, so what I put in the chat was just around how we can be more inclusive. When I think about, and this is, within the context of disability rights, but also when I think about gender equality just generally, is we come in with a very saviorist approach, right? And we only bring in actors to deliver on ready-made strategies. We go and sit in nice, fancy boardrooms in New York or in powerful capitals in the Western world, and develop strategies, and then bring in this, marginalized communities or local communities to deliver, on activities. And so I think it's important to bring in these groups from the get-go. And to do that, we have to think about where are we making these decisions, right? We just came back from New York in September for the Pact of the Future. How does this translate to that community in rural Kenya or in rural Uganda? What does global financial architecture reform mean, for at not just the meso level, but at the very micro level? We have to translate that, but we also have to bring people along. We can't sing "Leave No One Behind," but in going to this convenings, looking at visa restrictions, mobility issues, time zone difference, and all these things, we're in fact leaving people behind. So I think that's a long-winded way of just saying we have to rethink how we're making these decisions.
Yeah, yes. Thank you. And Mona also wants to know that Kenya has constitutional right to abortion, and it has also signed the GCT.
Exactly. So
yes.
Kenya has absolutely no business being on the Geneva Consensus Declaration. It's extremely embarrassing. Right now, we're sitting on the Human Rights Council, yet we're part of a declaration that completely bastardizes the right to safe abortion. So the Geneva Consensus Declaration is, in contravention of the Constitution. But for us to make headway, we need, and I think all the speakers have talked about this, we need to solidify our efforts. We need more collaboration. Because of the patriarchal structures, it might not be that easy to make advancements, but how do we make gender equality makes sense for private sector, for example, because we know private sector is very influential when it comes to government positioning. How do we change our advocacy and sell gender equality as a best buy? We have to crunch the numbers, and think about a return on investment type of advocacy and messaging. We have to rethink how we do things. I think there's also power in voices often not heard. If we're going to the government and it's Stephanie, always Stephanie, the government has probably dismissed me as quote unquote an abortionist. But what if I bring in a voice of an influential person who, rarely speaks on this issue? I think it's extremely powerful. So we have to collaborate and we have to bring in new voices to move forward together.
Right. Very, very true. There's a question for Debanjana. Debanjana, you will have to please speak the answer again. You are answering in the chat box. So Zafar Kidwai wants to know, how can we counter harmful narratives and reclaim the spaces meant for rights and human rights and development? And another question from Maya Joshi. Can treaties, declarations, and agreements take primacy over national anti-rights push?
Yes, thank you. Thank you so much, Shobha. First, I'm going to respond to Zafar's question.
Yes.
So I'm going to share a story which I heard from one of our, senior feminists a few years ago. She was talking about one of the very early ICPD conferences. And she was talking about something in the late 80s or the early 90s. And she told me that even at that time, there was this particular group that came to the ICPT conference, which is supposed to be a rights space. And there this person was, he was holding a placard with a small photo of a fetus and bang outside the plenary hall. And very slowly and silently, this person was making a point. And this is how they have occupied our spaces. This is exactly how they have occupied our spaces. They have come silently. They have listened to what we have said. They have co-opted our language. They have co-opted our rights language, our language on human rights, and they have used it completely to form their narratives in order to create discontent, in order to create, a negative impact on all the positive discourses that we were doing previously. So that's exactly why, as a program person, from a very programmatic, from a very, and as an advocacy person, as a program campaigning perspective, I would say that there are still a lot of stakeholders, especially providers, safe abortion providers, contraceptive providers, lot of lawyers like Steph here. There are many legal experts who are rights-based. We need to ensure that they are already with us. This movement needs broader stakeholder mapping, because many of us make this mistake of, when we are doing a stakeholder mapping, we kind of concise our activities. We only do a funder, a client, a community stakeholder mapping, but we don't do the broader stakeholder mapping. What about the providers? What about the legal expert? What about the legislators, the policymakers? And there are many such people who are sitting at the fence. We need to go and ensure that we are advocating with them. We have them in our rooms, in our conversations, so that they are able to make an informed choice. It's important when we are working as civil society organizations, when we are working as campaigners and defenders and activists, we ensure that we are paying attention to what the opposition are saying. Of course, they're saying rubbish, but we pay attention to ensure that we are able to counter the opposition. And we need to ensure that people, those who are on the fence, that they understand our perspective and join hands with us. We ensure that we have, if you look at the anti-rights movement, the opposition movement, apart from funding, I also spoke about human resources. They would have diverse people in their campaigns. They would have people from various perspectives, from various organizations, individuals with different economic backgrounds, and they are all talking together and making and creating disruption. So why can't we, as rights movement, be more collaborative in our approach? We also ensure that we need more inclusivity. We bring in more intersectionality in our work. I stopped there.
No.
If-
Yes,
if
the second
confused.
question, the second question, Debanjana, can treaties, declarations, and agreements take primacy over national anti-rights push? And I would like to add something there, that isn't it ironical or a paradox that countries have signed these international treaties and conventions, and at their own national level, they are doing just the opposite, going against those international treaties which they have signed.
Absolutely correct. It is definitely a huge irony. It's an irony of the decade. And in an ideal world, yes, the declarations, the global declarations, they need to take a precedence. But what do we see? That most of the state actors and governments, they sign these declarations, they are commitment makers, and they all go to these global conferences in Geneva, in New York, in Bangkok, and they do photo ops that, we have signed this declaration.
Yes.
This is our commitment, our 2-year commitment, our 5-year and our 10-year commitments. But when they come back to the country, they completely forget about it. And the nationalist agenda takes over. It's a very fearful situation that where we are living in, where most of the governments are becoming hardcore nationalist. We have seen that with the Dutch government cutting the Dutch fund just a couple of weeks ago, like massively cutting the SRHR funds, reducing the funds to negligible. And this is a horrifying trend. But yes, to answer your question, they should take a precedence. There needs to be a proper channel and a very strict channel of accountability, which is absolutely lacking at the moment.
Rita Vidyadana, she is a former editor of Jakarta Post, and she is asking Debanjana, how can you convince the opposition side to support your causes and campaigns?
That's a tough one. You cannot convince them because they have already formed the narrative. We need to get stronger and we need to ensure that we are countering the opposition. I'm again, going to share a little bit of an example. We had this young person in Philippines, a youth campaigner who is now a fantastic advocate. But we started working with him and that particular community in Philippines when he was 15. And at that time, he had a very different opinion on patriarchy, on machoism, on gender norms. And when we were having an international exchange very recently, he said that over the years, he realized how wrong he was. And this didn't happen overnight. It needed continuous advocacy. It needed continuous and consistent outreach. It needed sharing a lot of material, verbal, lot of exposure to that person, lot of, engagement with that person. It can happen, not that it cannot happen, but it's very difficult to happen. But probably we can approach one person at a time rather than the entire opposition, because it's huge and it has taken a huge format right now.
Right. You're right there, Debanjana. We have a question from Kalpana Acharya from Nepal. She's a very senior journalist from there, and she has a question for ABIA. Are healthcare services accessible and inclusive for women with disabilities, especially in terms of SRH? And what challenges do women with disabilities encounter on a daily basis? ABIA. Is ABIA there? Okay, we have Catherine's hand up. Catherine from Zimbabwe. Yes, Catherine, you would like to speak?
Good day from Zimbabwe.
Yes.
Talking about declarations where the heads of state go and append their signatures, we find that these declarations are written in such a way that we have to read between the fine lines. We have to critique those same declarations, because before they even leave the United Nations, the UNGA, the Geneva Conventions, wherever convention they are meeting, they are already let loose, because there is a phrase there which says at sovereignty level. So how can you have something tied at global level? Then any country can go and decide again on what is best for them. So in other ways, these become talk shops where they meet to agree on something that can be undone even before they leave the conferences. Our coming together, as she and her writes, is a great moment for us to be speaking. And one day our voices will grow so loud that they will listen to us. Thank you.
Thank you. Thank you. There is a comment from Shailesh White from India. Shailesh says, I work on critical studies on men and masculinities. And in my recent fieldwork on gender and education in an underprivileged community in Kolkata city, that's a metropolitan city in India, I happened to meet some students with disabilities, and I realized that they are completely marginalized from any dialogue about their gender identity and its impact on their education and career. Are there any good resources to facilitate this dialogue? and any policy level discussion on this issue, because I find myself completely unprepared to facilitate a dialogue with them. Any comments from our panelists? I think ABIA is left, but would Debanjana and Steph like to say something?
From an India perspective,
Yes, yes.
I could share that, Shailesh. We should go with other organizations that are already working in this space. And it is absolutely right if you look at access, if you look at hospitals, because where I was working earlier, so I was working on providing family planning, contraception services, and safe abortion services, direct services. So hospitals at the CHC, the community health centers and the primary healthcare centers, they wouldn't even have a ramp. How do you expect a disabled person to access that hospital for any contraceptive care? Similarly, we also saw a dangerous trend of people with disabilities being forced with permanent contraceptive choices like tubectomy or vasectomy. So, in a way, telling them that you are not capable to decide on your own, the state will decide. So, it's the access and also the mentality or where the society comes from is looking at persons with disability with a different lens, looking at them that they do not have bodily autonomy. We need to decide for them. And this is something that we need to counter. And this can only happen with more engagement. If you want, Shailesh, we could connect later through Shobha, and there are lots of organizations that are already working in this space in order to break this cycle. There are youth organizations, there are organizations working on men and masculinity like yours. And it's always better to use what is there rather than reinventing the wheel. Because we have seen that within civil society organizations, we tend to duplicate efforts. And that's something is absolutely redundant and unnecessary. If somebody is already doing something, we should really, make sure that you are using those resources to make your connect during your capacity building, that you have resources from these organizations and you don't need to reinvent the wheel yourself again. It's just a tool that we, again, it also comes to how good we are in sharing resources. We aren't the best in sharing resources. We do so much data collection, evidence, policy papers, reports, but how much do we share? We are not very good at that. And it's something that's very introspective for all of us to look how better we can share with each other.
You are right, Debanjana, and very often I have felt that language becomes a barrier because we just neglect the local languages and the people we would try to reach and have all that material which is with us translated and made easier for commoners like us to understand. I think I have felt that need very often. We have a question from Swapna Majumdar. She's a very senior journalist based in Delhi. Swapna, would you like to ask your question? Not, you have written it, but would you like to ask? Swapna?
Go ahead, Shobha. Just ask the question.
No,
Go ahead.
think you have the right to ask yourself. Come on.
Okay. Hi, Debanjana.
The question is for Debanjana. Yes.
So should I ask
Yes,
it?
please.
Yes,
please ask. Yes, please ask.
All right. So Debanjana, I just wanted to know from you. You really highlighted a very important point for India, which was the call for an increase in population in places where the fertility rate has reached replacement levels. And in India, that is happening in certain states. So my query was, are there any initiatives that you or related organizations may be taking up in India, or Are there any networks that are working? Because obviously this is a very alarming situation.
True, Swapna, and this pronatal narrative is growing not just in India, but in a lot of Asian countries, especially East Asian countries, where we are seeing there is a huge pressure on declining fertility rate. In terms of India, I'm going to share, this is not with what I do currently or the organization I work in currently. So in the previous organization, like I was sharing, that we were in direct service delivery, direct SRHR service delivery. And we used to work with the government to ensure that the unmet need is catered to. And those who are saying that the states that have reached replacement rate of 2.1 need to push the population, they are absolutely coming from nowhere. There is no data, no science, no evidence to back that. There is still a huge unmet need in India. Usage of modern contraceptives is extremely low in India, and this is across every state. And India continues to be highly dependent on permanent methods of vasectomy and tubectomy. There is hardly a basket of choice in India. What is available in India? There's nothing available in terms of basket of choice for short-term contraceptives. It's either IUDs, 3 years, 5 years, vasectomy, tubectomy. Do we have implants in the public sector? We don't. We have it in the private sector. But how many people can afford implants in the private sector? None. Then we recently saw a guidance note, which was fortunately taken back, that there was a crackdown on emergency contraceptive pills in India because it leads to promiscuity, or it leads to loose morals, or, people are now having, they are having sex, which the government is not liking. And then all of us from the civil society organization, we wrote, and there were many friends in the media who highlighted this before it could be tabled or before it could become a guidance. They alerted us, and we started writing to them, and we started sharing why ECPs cannot be banned and how regressive that is for women in India. So yeah, if you look at it, we are far behind, and those states who are saying that who are celebrating 2.1 and who are pushing pronatal narratives, they are absolutely in the wrong. It does not have any scientific evidence. If you look at our HMIS, if you look at our census and the last NFHS 5, you will see MCPR is the consumption is very low. It's not ideal. You will look at the unmet data, it's alarming. So
Can I just ask a supplementary, Roba? Is there time?
Yes, please go ahead. Yes.
So, the Debanjana, I agree with you completely that there is very limited choice for contraception, and usually women are the target for any family planning means. But there is also the other alarming thing is, and I'm sure you're aware of this, is that this is largely political as well. And there is, as you know, we have our census hasn't taken place, but it is supposed to from next year. And there is this delimitation exercise, and that largely depends on the population. So there is also this added danger. Why politicians or people in positions of power, like the chief minister, would push for this. So, do you think there is a need for a more concerted push from feminists, from organizations that work on this? And I think and not in silos. I mean, not just SRHR organizations. It should be a kind of a all pervasive, kind of a bigger network that pushes for this so that there is some kind of impact.
couldn't agree more, Swapna. And I think, this is where it ties to not just feminist groups, actors working on MCPR, actors working on safe abortion and comprehensive abortion care and LGBT rights. We also need people from girls' rights, child protection to also join in, because it is going to impact everybody, especially in India. And yes, if the state head, or like you said, the chief minister pushing an agenda like this, I mean, as you know, that it's not anecdotal and it's quite right. And it's something that has taken place in some of the states. We have also seen incentive-driven family planning in India. And now we are seeing incentive-driven family push also in India. And we need to learn from our neighboring country,
Hello.
China. China had a one child policy for the longest, and how the country suffered, and how a huge generation of people suffered. And now China has come back, and they have come back with a two-child policy. So again, the policy driving something that should be a choice is itself very harmful. And I couldn't agree more when you say that in India, all the actors, all the civil society voices need to come together. And you are right. Nowadays, we see very less public data. Census, we don't know when it's going to start. HMIS data, you need login, you need so many information parameters to fill in before you can access HMIS data in India, which was easily available pre-COVID. Pre-pandemic, it was easily available. We used to base our research on HMIS data. Same with NFHS 5. Earlier, civil society organizations used to inform NFHS 5 matrix. We used to be called to inform that, is this matrix fine? Like, specialist organizations would be called to inform, are these questions fine? Is the survey looking fine? But now nothing of that happens.
Yeah, unfortunately. Thanks, Debanjana.
Thanks, Sapna.
Oh, sorry, I was muted. I'm just saying that Abia would be joining us again. She had some connectivity problems. So, but we have questions for her. So she's coming back again. Mhm. And there is a comment from Kujay Kaur to what Debanjana said just now, that Chief Minister of a state advised families to have more children. Yes, that is happening very much in India these days. So Abia is back. Abia, there are questions for you. So
Yes.
yes.
Yeah, I'm sorry. There was
Yes,
a
no, that's fine. There is and maybe some you had answered in the chat, but we would like you to hear it from you also.
yes.
Kalpana Acharya, a very senior journalist from Nepal. She wants to know if health services are accessible and inclusive for women with disabilities, especially in terms of SRH. And what are the basic challenges which women with disabilities encounter? Would you
Yeah,
just
thank you.
recap? Yes.
Thank you so much. Yes, I've responded that earlier that the sexual health and reproductive rights for services are not that much inclusive for women and girls with disability because there are a lot of challenges they are facing. One is the stigma that families don't provide them the support to take those women and girls with disabilities to the health services. Secondly, they are not aware about their own rights, so sometimes when it comes to their sexual rights or their own families, then it came so complicated for them to understand that it's a basic thing. But they, during the COVID response, during all those crises, they are the first one who lost that all the connections with the health systems. The transportation, the access, it's not accessible. Secondly, the hospitals trainings and the whole understanding, it's very complicated, like how you are providing those facilities to women and girls with disability, which is accessible and also in the reachable for them. The immediate like policies, and we have started to work on this article on that, and it's responded that very clearly that women and girls with
We cannot hear you, Abia. I think connection has gone off. We cannot hear you, Abia. There is some connectivity problem at her end. We will wait for her if the problem is resolved. And I just wanted to add on to what Debanjana was saying earlier about the basket of choices not being available there at all. And, you know, even today, many women, and I'm talking of metropolitan cities, they do not know that a female condom exists. There has been so much of money spent in advertising on male condom, and still the male condom use is dismal. But women don't even know. Many of them don't even know that they have the female condom. And now we are talking of the dapivirine ring and others, which I don't think will be able to see the light of the day in many countries. Yes, there are some more comments, I think, which we can read. Easter Rokesh says, even in Kenya, the burden is on women, and if the husband partner refuses, she will not get family planning. Yes, Debanjana, you would like to say something on that?
It is true in Kenya, it is a problem. And also in India, though consent is not a problem in India, the access continues to remain a problem. And of course, when it comes to family planning in India, it has a horrible history of vasectomy, wherein vasectomy was, I mean, you know, those of us who know a little bit of, you know, what happened with the vasectomy drive earlier in the 70s and 80s in India, it was forced vasectomies. And there were many evidences showing that people as boys as young as 18, 19, they were also sterilized. And that created such a stigma that vasectomy does not have any uptake right now in India. But does that mean that the burden should fall on women? So it is a problem which the government could not solve. They could not raise awareness around uptake of vasectomy and how vasectomy is a much simpler and safer procedure than tubectomy. Tubectomy is also a very safe procedure, but it's more complicated than vasectomy. We have, in my previous organization, when I was working, we have seen people come, take vasectomy, riding the rickshaw back home. They are that fit. But for tubectomy, you have to observe that person for 48 hours. Complications can happen after a week as well. It is absolutely burdened on women. It's a disproportionate burden on women. And if you look at the numbers again, the number of tubectomies happening in India versus the number of vasectomies happening in India, it's alarming. And that coupled with the lack of basket of choices, like female condom is available in every pharmacy. Rightly said Shobha, nobody knows. Forget about Dimpa, forget about, you know, implants. Those are probably something people haven't even heard about. I remember growing up in our national television, we used to have, you know, advertisements on family planning and pills, regular pills and all of that. How many family planning advertisements do you see on OTT platforms these days? None. But there was a time when India used to talk about all these things, but we have become more conservative in our advertisement and marketing. We hardly see any condom ads. I remember when Kama Sutra, one of the major companies in India, they were advertising in prime time in India around 9 p.m. They had to withdraw all the advertisements. So that's the kind of overreach that's there.
Right. Very right, Debanjana. And I wish the conversation would continue. It's an endless conversation, and I'm sure we will convene again for it. But In the interest of time, we now come to the close of today's session. And my sincere thanks to each of our speakers for their invaluable insights, and a big shout out to our participants for their very lively interaction. And I think for all of us, next year, 2025 is an important year when the 69th session of the Commission on Status of Women will do a review and appraisal of the implementation of the Beijing Declaration and Platform for Action, which is indeed a blueprint for achieving gender equality and women's and girls' rights everywhere. So the 16 days of activism is an opportunity for us to reinforce commitments, call for accountability, and action from decision makers as we approach the 30th anniversary of the Beijing Declaration and Platform for Action. Let us hope for better enforcement of positive action on the ground. And before we end, I would just like to remind our media friends that apart from increasing media understanding and engagement around sexual and reproductive health and rights, particularly on abortion care with the lens of equity, the She and Rights sessions also provide an opportunity for media actors to engage in the She and Rights Media Fellowship Awards 2024-2025, which will be presented in a high-level online award ceremony to be held around World Health Day 2025. And let me see if there are any more messages. Some of them have written. You can read the chat box. And Hari Singh says, marriages and remarriages of HIV positive male, female, and widows, divorcees is a big challenge. No policy available at NACO in the Ministry of Health as of now. Okay, now with this, I would say goodbye for now till we meet again next month. And thank you once again to all of you.
Thank you.
Have safe and healthy days.